Hey, it's Dr. J here in the house. Evan, how are we doing today, man? How was your weekend?
Hey, weekend was good. Life is good. Spring is good. The grass is green. The sky's blue. I'm ready to dive in, man. I missed chatting with you last week. I don't know if we chatted or not. The way time flies, I can't keep up when our last chat was, but I'm ready to dive in today.
Yeah, we were able to chat, but just not on the air. But I'm glad that we're back on the air, brother. You're like a poet and you didn't know it today. I love
I
it.
know, I know. Well, let's chat
Cool.
about iron, man, because here's the deal. Let me just give the audience a little backstory. I told you, I said, man, I'm having a couple random heart palpitations and I'm not sure why. And I was able to successfully mitigate it using motherwort, which is one of my favorite herbs that can help with heart stuff. But that's not root cause. I mean, that's just an herb that really helped me feel better. And I ran some blood work just to investigate because you said, hey, man, maybe you've got some thyroid stuff going on. And the reverse T3 was elevated on my report, which is, as you mentioned to me off air, probably a stress thing, just working hard, being busy, keeping up with a little baby. And then two, the thing that showed up was my iron. My saturation was way too high and my ferritin was way too high. We like to see men and women anywhere between like 50 and maybe 100 at most of ferritin or so. And I was over 500. And so I had found out, okay, I've got an iron overload. So what I then did was went on 23andMe and looked up the genes for hematomacrosis to see if that's me, because Irish people supposedly have a higher risk of this. I had no genes at all, man. Like, I checked out perfectly fine. I don't think it's that issue at all. And so I started doing some research into the literature on what can you do to start chelating iron naturally, because there are some pharmaceuticals that are supposedly very, very ridden with side effects. So I knew I didn't want to do that. And so I found some cool stuff on curcumin. So I've been doing 3 grams per day now. I've been doing like breakfast, lunch, dinner curcumin. And then I'm doing some quercetin, which is, there's a little bit of literature on that. And then I'm doing also resveratrol and then chlorella. And then yesterday I went to the American Red Cross. I donated a pint of blood, which is the most that they can take from you. And then I'm able to go back in 56 days to go donate another pint. And then according to Mercola, he mentioned that he had an iron overload issue at once, and his dad had it too, where his ferritin was over like 1,000, which increases risk of cancer at that level. And that with an infrared sauna and detox strategies, Mercola said he was able to get his iron and ferritin down faster than even giving blood. So I'm going to get back into the sauna and start pumping up the chlorella a bit more, and hopefully I'll be able to fix this issue quickly.
Do you have your own sauna at your house?
I do. Yeah, it's right here.
Oh, nice. Is that a Sunlighten?
No, it's not. It's called Radiant Health. It's a guy out of Canada named Randy. It's pretty good. I haven't measured the ELF, like the electric fields, because people talk about those, but I have measured the magnetic fields, and magnetic fields are basically non-existent with it. So
Oh, that's great.
I think
Excellent.
overall it gets a passing grade, but I don't know electric field status.
Got it. And again, iron overload is interesting, right? With our female patients, we have more of an issue with uh, iron-based anemia or iron deficiency because
Yeah.
females menstruate, especially if they're not menopausal yet, they're menstruating, so they're losing blood every month. And if a woman is estrogen dominant, right, the ratio of estrogen to progesterone is a bit higher than normal. Normally is like a 23 to 25 to 1 ratio for progesterone to estrogen. As that ratio drops, even though estrogen is still lower than progesterone, that starts to signify that you're in a state of estrogen dominance. And one of the big things you can see there is a prolonged menstruation state. So when you start bleeding, you may spot for a few days, go into maybe 4 or 5 days of bleeding where you're doing heavier menstruation, so greater than 4 tampons per day. And that's a big sign that you're probably going to be losing too much iron. And iron's important because it helps binds to the hemoglobin and carries oxygen to the cells. So any cell that's involved in aerobic metabolism, which is energy from combustion of oxygen, not anaerobic. Anaerobic is like a sprint or a quick lifting session. It requires no oxygen, but a lot of metabolism requires aerobic, and you need iron that's bound to the hemoglobin to carry that oxygen, right? You go back to the old science experiments when you're in middle school where you have a candle and you put a jar over the candle. After a certain period of time, the candle goes out because it needs oxygen for the for the fire to continue to burn, right?
Yep. So let's talk about like symptoms and maybe side effects of what would happen with these women. And we see it every single week that there's an issue with some type of anemia. A lot of times it's a ferritin anemia, which is a specific biomarker. Ferritin is an iron storage protein that conventional doctors don't test for. And it's very important to test for ferritin. So, a lot of times we're going to see hair loss, and it could be anxiety, it could be depression. And then when you get to the really low levels, like usually when women are around 20, and don't quote me because I don't have it in front of me, but I want to say I'll pull up my blood work to give you the correct uh, the correct marker. But I think it's NG. So what is that? Nanograms over milliliter. I don't think it's, what is it, deciliter? I don't think it's that. I think it's ml. Let me check here.
If you're using your basic test on LabCorp or Quest, whatever that number is, that's going to be in the correct standard deviation. So if you're at home and you're wanting to test yours out, as a female, we want at least 30, ideally 50 to 80 is probably the sweet spot. As guys, we don't menstruate, right? So it's easy for that iron to accumulate. I have a history of higher iron as well. So it's important if I try to get my blood, 2 big blood tests drawn a year that they require a lot of vials. Sometimes that can be enough. But like Evan said, sometimes you may have to call up the Red Cross and donate that blood. That's a great way to get those iron levels dropped. Evan also mentioned the sauna and then also the curcumin. And we like the liposomal curcumin because it absorbs a lot better, or at least the curcumin with the black pepper, because that's another great way of lowering your iron. And again, high amounts of iron can increase oxidative stress. So if you're a guy or a menopausal female, you have a chance of higher levels of iron that could easily increase oxidative stress. And I think some of Evan's side effects that he was experiencing the last few weeks could have easily been caused by his higher levels of iron. So one of the things that Evan was mentioned was irregular heart rhythm. And I think some of that improved over the last couple of days since we saw his iron was elevated. We gave him some therapeutic phlebotomy, right? That's just getting your blood drawn for the purpose of nothing else, of, let's say, just getting it drawn because of the benefits of lowering the iron. And we saw some amazing improvements in just that irregular heart rhythm off the bat, right?
Yeah, I mean, I told you, like, I'm not joking. Yesterday, I went to the Red Cross yesterday as the time of this recording. I'm not joking. I felt 20% better because I've been having some brain fog too. I've been feeling real spacey, and I've got my labs rerun for the gut. I do not have a candida overgrowth, which was kind of my suspicion. I thought, maybe this is a yeast problem coming back. Because that typically causes brain fog and fatigue, because I was having a little bit of fatigue, a little bit of heart palpitations. No, it was none of that. It wasn't yeast. It was this high ferritin, high iron overload. I'm not joking. I felt 20% better. My head was clear. I had more energy. It was almost like a weight was lifted from my shoulders. So back to the reference range. Yeah. So my levels of ferritin were 548 nanograms over milliliter. And kind of optimal range, as you mentioned, something like a 30 at a minimum, maybe up to like 100 or so. And here's the deal with this iron overload in men. I mean, this causes damage to your liver. Like, you're rusting from the inside out. So I looked up a couple statistics and found that there's 36,000 deaths per year from liver disease. I'm guessing this is in the US, and 6,000 liver transplants. And most of these cases can be affected by excess iron. And it says here, even in the absence of a hemochromatosis genotype. So if you don't have the genetic susceptibility to build up excess iron, if there's other causes, you can still end up with what they call, I call it NAFLD, but non-alcoholic fatty liver disease. And there's a lot of herbs that we can use and that we do use to try to help reverse or mitigate that. Cancers, you mentioned the heart arrhythmias, Graves' disease, supposedly a link there, premature aging, atherosclerosis, insulin resistance, type 2 diabetes. I mean, this is something that's so easy to fix, though, but it gets skipped all the time.
100%. There's a couple of markers that you can look for on your comprehensive metabolic panel on your blood test. I mean, you can look at your ALT, which is alanine aminotransferase, ALT for short. And this is an isoenzyme. So the L in ALT, we think of that's for liver. That's looking at the liver. We have the AST, which is the aspartate aminotransferase. That's the aspartate transaminase marker.
And to be clear,
and the S in that is typically we think of skeletal muscle. So that's another isoenzyme, but we think more skeletal muscle. And the last one is GGT, which is gamma-glutamyltransferase. And that one is going to be kidneys, kind of liver, gallbladder, pancreas. So we look at those isoenzymes. If we see any elevation in that, that could partly be from the oxidative stress of elevated iron, but it could be from alcohol and other things too. So it's not like a binary on off. If you have it, there's an iron issue. It could be other things. Go ahead, Evan.
Okay. Yeah, no, that's what I was going to ask you, just to be clear. So when we see an elevation of ALT, AST, or GGT, that's when you can run into problems. So this guy, I think his name pronounced Jerry Koenig. He was the former chairman of Iron Disorder Institute and Hematochromatosis Foundation. He says that women with a GGT above 30 have a higher risk of cancer and autoimmune disease. So there is a link between autoimmunity and this iron overload, and that would be indicated by GGT, ALT, AST, and as you mentioned, other reasons too, like infections. So maybe we kind of transition and talk about infections a bit, because if you, maybe on the low iron side, if you have a H. pylori infection and you have no HCl, wouldn't it be true that that could be contributing to an iron deficiency anemia?
Yeah, if you have H. pylori, that could be easily driving down your hydrochloric acid levels, and that could make it harder for you to absorb and ionize your iron for sure. Also, just the inflammation in your gut and like the atrophic gastritis, the thinning of that gut lining and the inflammation in your gut could make it harder for you to absorb a lot of those nutrients too. So it could easily be on the digestive side or on the absorption side, because it's not a guarantee just because you eat it that you're going to absorb it, assimilate it, and utilize it. We also have to make sure those other bottleneck factors are addressed. And also we just have to make sure we're eating it too. If you're a vegetarian or vegan as a guy or a gal, you could easily be low in iron that way too, because there is iron in plants, right? If you look at spinach, it's high in iron, but it's a non-heme based iron. Non-heme based irons tend to not support iron levels in the blood, not serum iron, but like iron, like in ferritin, tend to not move that needle as much. If you look at chlorophyll, right? Chlorophyll is basically, if you look at it, it's got a big magnesium right in the middle of it. All right. It's got a big magnesium molecule right in the middle of it. If you look at animal-based iron, it's got a big iron right in the middle of it. So if you look at animal-based protein, right, it's got a lot of iron right in the middle of it. You look at plant-based chlorophyll, it's got a big magnesium in it. So plant-based doesn't quite move the needle with iron, more with magnesium. Animal-based will move the needle up with iron, and it's much better to absorb with animal-based iron as well.
Yeah, well said. And we've tested the vegetarians and vegans, and we'll continue to say, hey, look, it's generally going to create an issue. I had a woman who was a vegan for 10 years. Her ferritin level was in the teens. I want to say it was like maybe 17 or 18. She couldn't catch her breath. She thought she like had a heart attack or something, like she was having heart failure because she was having trouble breathing, and she was losing hair in clumps, especially in the shower. Her fatigue was just insane. She almost was going to quit or have to quit her job because of the level of fatigue. Luckily, we tested ferritin. We started boosting up ferritin. We were giving some vitamin C. We were getting her to do a little bit of some grass-fed beef. I could only get her to do it like once a week, but I was happy that she would do it at all. And then also increasing the enzymes and acids to get her to digest those meats better, because she'd been avoiding meat for 10 years because she said she felt sick when she ate meat, which is probably a sign that she had too low stomach acid, so she couldn't digest meat. So, oh, I'll just be a vegan because I feel better without meat. And it's like, no, you can't digest it. That's the problem, not meat. Meat was not the problem. And then we gave her some lactoferrin, and then all of a sudden ferritin went up, and then the hair started regrowing, and then she could catch her breath again. So, I mean, low iron just as big of a deal as high iron.
I think so too, especially if you're a cycling female. Definitely don't worry about the iron overload. You're going to want to worry about the low levels, and the big factors that are going to drive that are going to be an absorption, digestive, infection, low stomach acid thing, a vegan vegetarian thing, or an estrogen dominant thing where you're having excessive menstruation. Those are going to be the big three causes of why that may happen. And the markers that we look at is, number one, do you have elevated ferritin? I mean, I would say you're going to see in the guys, upwards of 250 to 300 on the high ferritin. You may even see iron serum high, maybe not. You may see iron saturation very high, 50 or, 40, 50 and up. You may see your binding proteins on the lower side, UIBC and TIBC south of 250 or on the lower 200s, right? These are basically indirect, or kind of, I should say, indirect marker. So those proteins go low when iron's high, right? These proteins are like fingers. So the more you want something, the more fingers are grabbing at it, right? The higher it is, right? The higher it is, that typically means the lower the iron is. We want more fingers grabbing at it. The lower these binding proteins are, right, that means the higher the iron is, because we don't need as much. There's less fingers grabbing at that iron. So you see UIBC and TIBC on the lower side. It's an inverse kind of marker. So people get their heads kind of, it's hard to get their heads wrapped around it. It's kind of like TSH. TSH goes high when thyroid goes low. It's kind of like that.
Yeah, my saturation was elevated as well. My iron saturation, the reference range here from LabCorp was 15 to 55. My saturation was at 66.
Yeah, there you go. That's it. And then how were your binding proteins? Did you do a UIBC or TIBC at all?
I did, yeah. So TIBC actually showed up okay. Reference range was 250 to 450. I showed up right in the middle, 358. UIBC reference range was 111 to 343. I was on the low end there. I was only at 122. So kind of bottoming out there on the UIBC.
Yeah. So the UIBC, you could see it, but in the hierarchy of evaluating this, we would always look at ferritin and iron saturation will be our top two markers we'd look at. We wouldn't need to see the other ones being out of range for us to move in that direction, but you did see the UIBC starting to go low there. So that makes a lot of sense.
Yep. So I can't wait to retest and get this ferritin back down, and I'm going to proceed with the sauna. You know, that was another thing too, is that the sauna was causing me to have like my heart racing, like I was mobilizing some type of toxin. So I had stopped doing the infrared sauna for a bit because I was feeling a bit anxious after it, but I'm going to keep bumping up adrenal support, liver support. And if you have other recommendations of what I should be doing, I'm going to add it in, and hopefully I can make the sauna a regular practice again and try to speed up this whole ferritin getting back down.
And that's interesting that Mercola was doing the sauna to help that get down. I mean, your conventional is going to be your therapeutic phlebotomy. That's going to be the best way to clean that out. And of course, your body needs about 3 to 5 milligrams of iron a day minimum. But a lot of the symptoms of too much iron can be similar as low iron. This is where it kind of gets tough, right? Chronic fatigue, which you think is like an anemia, low iron, like a hypochromic microcytic anemia, right? It's hypochromic microcytic because the red blood cells get little bitty and they kind of get crumpled and really small when you have low iron, because that iron gets bound to the hemoglobin and becomes a really good backbone of that red blood cell. But you can see with the too much iron, right? Chronic fatigue is a symptom of too much iron, but it's also a symptom of low iron too.
I know. I was tired, man. I was really tired. I'm not joking when I say 20% more energy yesterday after I gave that blood.
Yeah. Also, hypothyroidism is one, but if you don't have enough iron, you need iron to make thyroid hormone, right? Depression, another one. Adrenal function issues is another one. Elevated liver enzymes, like we mentioned, the ALT, AST, GGT are big ones. Joint issues, skin color, right? Your skin can look a little bit more bronze, right? Another one there. Blood sugar issues, joint pain. So a lot of symptoms that, and this is kind of tough. It's on both sides of the fence. Some of these symptoms you may think that you have low iron with, right? But again, the first thing is if you're a cycling female, you can always lean to the side that it's going to be lower iron. Right? And then if you're a guy, do you have a lot of gut issues? If you don't have a lot of gut issues, like a malabsorption or a known IBD or bowel issue, or you're on proton pump inhibitors, or you have an active H. pylori infection, odds are it's probably you're going to be prone to having a high iron issue. So just kind of rule out those things first, check those off. If you check any of those issues off as being a problem, then it could be a low iron issue with the gut issues and the absorption issues for sure.
Yeah, well, that's why you got to test, not guess. I mean, that's our whole philosophy behind this. So instead of guessing, like what I did for a bit, I thought, what's going on? And you were like, hey, man, let's get your thyroid checked. And I thought, well, I'm gonna look at the iron too while I'm at it. If I'm gonna go get poked, I might as well maximize my blood draw and get as many things run as I can. And I ran a Lyme co-infection thing too, because I told you I had this weird sensation in my head, like somebody was pouring warm water over my brain. And I thought, okay, maybe that's Babesia, because I've already pulled off several ticks this year. Ticks are extremely bad this year, and I've already gotten bit several times. So it was luckily not Babesia, and no other infections that were active showed up. So I'm thinking, I'm not going to say I found the root of indole roots, but I think I'm onto something pretty big here.
And it's good. I'm glad that, you also ran that full iron panel with the CMP. That's great. And typically running a comprehensive metabolic panel or a comprehensive bioscreen like we did with you is a great way, because then you can look at all the liver markers, the protein markers, you can look at the full CBC, you can look at all the immune cells, you can look at the vitamin D, the inflammation, the full thyroid panel. And again, reverse T3, which was very elevated with you as well, that's going to happen in the liver. A lot of that reverse T3 will come from the liver as a way of binding up the thyroid. And it could be some adrenal stress from that iron, right? Remember, the high iron symptoms can be adrenal dysfunction stuff. So I think getting that iron down will also help support your adrenals and also help support your heart too. So I think that's a really good thing we discovered there.
Yep, I agree. And I know we got to make this one short and sweet, but I just have one more comment, which is that, as a practitioner, Dr. J and I are always trying to figure out, okay, what's the biggest priority for someone in terms of lab testing? So we're generally going to run several lab tests right away, a lot of functional medicine labs. But this just goes to show you that you can't downplay the benefits or the potential benefits of getting blood drawn. And if you have health insurance, you have a conventional doctor that's going to listen to you. Like I mentioned, they're not going to do ferritin unless you force them to. They're just going to run maybe your total iron, and that's it. And I wouldn't have found this problem if I didn't run more comprehensive labs. And so sometimes we have clients that say, oh, Dr. J, I only can afford to do this or that test. And it puts us in a really hard situation, because it's like, okay, based on your case, and maybe we'll save this for part two, Justin, because we wanted to chat more about other sources of fatigue, which could be mitochondria, adrenal related, liver related, Lyme co-infection related. So like this fatigue umbrella, Justin or I might say, oh, we think it's gut infections or we think it's this or that. But if we're only able to do one lab test, like, okay, we found the ferritin for me. So maybe that's why I had a couple random heart palpitations. But then we got to make sure we get the gut work to look for the infections, which I did, and I was clear. Then we got the blood work to make sure I didn't have Lyme and co-infections. That was clear. So it's like, if you're only getting a 20% workup, you're still missing some other potential big pieces of your puzzle. So really, really, really eventually make sure, everyone listening, you get your full workup. You don't just want to get the blood. You don't just want the adrenal test. You don't want just the stool test. You've got to get all of it, because you're missing stuff if you don't.
Absolutely. I'd say some of the false positives that we could see is high amounts of inflammation can increase our iron levels, because that's creating inflammation. And then we have this oxidative reaction, and that can increase our iron levels. So we could have a false positive, a very high iron. We'd see ferritin really high, and we may see iron saturation normal, right?
Well, the good thing is I could rule that out, though. Now, I don't have my HSCRP from blood, but I do have my calprotectin from my stool panel, and it was in range. So I at least know that gut inflammation's not there. But
no,
I don't know.
With you, I don't think it's an issue, because you also had very high levels of iron saturation as well. You had high levels of iron saturation and high ferritin. But let's say you may have just had high iron or high ferritin, right? Ferritin is a storage form of iron. Iron serum is what's in the blood. Ferritin is kind of the storage of that. And then iron saturation is kind of how full the cell is. So you may have iron saturation and normal, ferritin really high. Then if we saw that, I want to look at other inflammatory markers, homocysteine, C-reactive protein, maybe a erythrocyte sedimentary rate, ESR, just to get a window to see how other inflammatory markers look. Let's look at the liver enzymes and such as well, because those may be elevated if there's a lot of inflammation, because we want to make sure, is it just an iron thing, or is there an inflammation thing? Now, the nice thing about it is, if you go and give blood, that's not necessarily a bad thing, right? So it's not going to hurt you either way. But again, we want to make sure, if it's an inflammation thing, we want to get to the root cause of that inflammation, whether it's in the gut or whether it's with stress or a malabsorption thing. The nice thing is, curcumin, which helps drop iron, is also a nice anti-inflammatory. So either way, I don't see, if you want to do like a curcumin supreme or a liposomal curcumin like the one that I provide, that's great. If you want to go give a therapeutic phlebotomy, that's great. If you want to go do a nice sauna session like Evan suggested, I think all those solutions are good, and there's not really a big downside to either one of those.
Agreed. I think the only downside would be if you're giving blood and you were incorrect about, as you mentioned, maybe it were just a ferritin issue, but iron was okay. You could push yourself towards the anemia. Like if iron was maybe right in the sweet spot or kind of on the low end, but ferritin for some reason was high, then you did a big blood donation like I did, you might actually make anemia worse. So I do agree with you. You've got to find the root cause of why the ferritin was up in the first place. Was it inflammation from something?
Yeah, I mean, if your iron was low, you'd see it. You'd see either the IBC or UIBC on the higher side. You see some of those markers, the iron saturation below 25, 20, ferritin below 30. And a lot of times, if you're a cycling female, they're going to do a prick of your blood. They're going to drop it into this solution and see how fast it drops, right? The faster it drops, that's an instant sign that you're anemic. And also, if you're a vegan, vegetarian, if you have any of the history of excessive menstruation, that's going to be a pretty good tell. So if you're listening to that, then you may want to avoid doing that, the therapeutic phlebotomy stuff, until you see a good functional medicine practitioner like myself or Evan.
Good. Anything else? I think we did good, man. We hit some of the therapies. We hit some of the lab markers to look for. We mentioned the testing, making sure you're not just getting one piece of the puzzle. Anything else you think we missed?
No, I think we did a really good job. I just would ask everyone listening, give us a thumbs up, give us a share. We appreciate it. We love doing these podcasts live. I mean, no cue cards here, right? There's no teleprompter we're reading off of here. Teleprompter free. We do see a lot of the questions coming in. We just ask that if you want to provide a question and you want us to kind of address it, we're not going to read the question out, but I'll interject the question into the conversation, but just try to make sure it's about the topic. If you go on side topics, save the side topic issues for my live Q&A calls. I'm happy to deal with all the side topics then, but just try to keep every other question on the topic somewhat, at least tangentially.
Cool. So if you guys want to reach out for a consult, look up Dr. J himself, justinhealth.com. You can reach out, schedule a call with him or his team. If you want to reach out to me, my site, evanbrand.com. We're happy to help. Make sure you're subscribed to the podcast because there are other pieces of content out there that you've probably not heard that are helpful. So we've got hundreds of hours of free stuff. Don't miss out. Go research.
And if someone wants to get their blood tested, I have a link to the comprehensive bioscreen. If you go to my site, justinhealth.com/shop, and then click on lab tests, you'll see the comprehensive bioscreen, which will cover all the tests we chatted about today. And I'll put the link below in the YouTube video. So if you want to just grab that and run over to your local Quest now to get it done, that's a great first assessment. I know Evan probably has some similar labs on his site as well.
Yep. So just to be clear how that works for Justin. So if you guys are not even a client in his clinic, you can purchase the lab test. His office contacts the lab. They give you a piece of paper. You take that piece of paper. No doctor needed. Dr. J is kind of your man. He replaces the doc. And then you go to your local lab corp. You get the blood draw. And then Justin and his team send you the results in an email. And then if you want to work with them, do it. If you want to just take your labs and review it yourself, then you can do that too. But this is saving you a trip to the GP to try to beg them to run these markers. Justin's blood test is going to be something more comprehensive.
Absolutely. Well, hey, what a great chat today here, Evan. Look forward to chatting again next week. And then if you're listening, thyroidresetsummit.com, thyroidresetsummit.com. Click the link below. My summit's coming up this fall. Best thyroid experts in the world. Evan Brand, yours truly, will be there. Myself, I'm also interviewed. So really excited for that. Evan, what a great chat today, man.
Take care.
Hey, you too. Take care. Bye now.
See ya.
Bye.